When I first graduated, I was 25 and I started working for a fellow who had a really busy practice. When I first came in, he said, "Rick, I am done wrestling with the oral surgery, you're up." And so right away out of school, I was getting to do a lot of procedures that a lot of my classmates weren't able to do, but I really liked it. So I've always done a lot of oral surgery. So we do wisdom teeth, of course, and actually, if it's something where the patient needs to come to sleep, I do have a guy that comes in. He'll put an IV in the back of your hand, and that's kind of nice because the next thing you know, you're at home and somebody's looking after you and it's all done. But I've done a lot of different types of oral surgery. Mainly, we take out teeth that just can't be saved. And again, I've learned a lot since I first got out of school. And today, we try to, it sounds funny, but we try to finesse extractions rather than putting a lot of force. In fact, I went up to Detroit and took a course there where Dr. Golden developed the physics forceps, and it really is an ergonomic forceps. It applies all the force to the tooth. So you take it out, again, it's a physical thing, but you take it out gently, and you leave the bone around the socket, because if you go in there and blindly, yeah, you can damage the socket. But I do that, and that's really important because I do a lot of implants, and I do immediate implants. So we take out the tooth, we have a healthy socket, we put the implant right back in that day. And that's nice because you help people get back to where they're having teeth that look like teeth, and they're solid. They can eat hard things and sticky things. They don't come in and out. And you can get them back in that form very quickly.